Good evening, wherever you are. This is Sophia Reyes from ConferenceHype. Our segment will focus on Weekly Update 2026 W28, Location of GI Lesions with Bleeding Potential in Patients with Iron Deficiency Anemia, a multi-center perspective study. Alina Park is covering Gastrointestinal Endoscopy. The topic is Location of GI Lesions with Bleeding Potential in Patients with Iron Deficiency Anemia, a multi-center perspective study. Background: guidelines recommend esophagogastrodiodnoscopy and colonoscopy to investigate iron deficiency anemia, but not small bowel examination. Methods: prospective, multi-center clinical trial. Results: in 170 patients, small bowel capsule endoscopy identified P1 or P2 lesions in 85, EGD in 48, and colonoscopy in 34. Discussion: lesions with bleeding potential were more common in the small bowel than upper GI tract and colon in patients with IDA. Grant Ivy is covering gastrointestinal endoscopy. The topic is temporary removal, sustainability indicators for gastrointestinal endoscopy, a framework proposed by the Canadian Association of Gastroenterology and the American Society for Gastrointestinal Endoscopy. Background: the publisher regrets that this article was inadvertently published and has subsequently been temporarily removed. Methods: the article will be reinstated as soon as possible. Results: the publisher apologizes for any inconvenience caused. Discussion: the full Elsevier policy on article withdrawal can be found at Talia Stone is covering gastrointestinal endoscopy. The topic is clinical outcomes of primary versus conversion, endoscopic ultrasound-guided gallbladder drainage after percutaneous drainage, a multi-center study. Background: and AIMS, endoscopic ultrasound-guided gallbladder drainage, is recommended over percutaneous transhepatic gallbladder drainage in patients with acute cholecystitis who are at high surgical risk. Methods: we retrospectively analyzed patients with acute cholecystitis who underwent USGBD using electrocautery-enhanced lumen-opposing metal stents at 3 tertiary centers. Results: a total of 141 patients were included. Discussion: conversion USGBD is comparable to primary USGBD in terms of technical success and safety. Sage Harlan is covering gastrointestinal endoscopy. The topic is Rimimazolam versus Midazolam for moderate sedation in gastrointestinal endoscopy, a systematic review and meta-analysis of randomized controlled trials. Background: and AIMS, sedation is commonly used during gastrointestinal endoscopy to improve patient comfort and procedural tolerance. Methods: a systematic search was conducted across PubMed, Cochrane Central Library, Google Scholar, and ClinicalTrials. Gov from inception till March 2026. Results: a total of 9 RCTs involving 1,251 patients were included. Discussion: Rimimazolam demonstrated sedation success comparable to midazolam in patients undergoing GI endoscopy. That is it for this segment. If there are any medical conferences or events you want covered, tag our team on X.
This is Conference Hype. Stay with us, coverage continues.
Luna Vale is covering gastrointestinal endoscopy. The topic is a multi-center randomized controlled trial comparing metallic stents with 10 versus 14 diameter for distal biliary obstruction caused by unresectable pancreatic carcinoma. Background and AIMS, endoscopic retrograde cholangiopancreatography with metal stent placement, is the standard treatment for biliary drainage in patients with unresectable pancreatic cancer. Methods: this multicenter randomized controlled trial enrolled patients with unresectable pancreatic cancer who required biliary drainage. Results: a total of 118 patients were enrolled from 20 institutions. Discussion: the 14 group demonstrated a longer TRBO. However, the difference did not reach statistical significance. Ryan Reed is covering gastrointestinal endoscopy. The topic is capsule endoscopy for treat-to-target monitoring in Crohn's disease, a systematic review and meta-analysis. Background and AIMS, achieving mucosal healing has become a central therapeutic methods. A systematic search of PubMed MEDLINE, Central, Clinical Trials Gov, and Google Scholar was conducted from inception to November 2025. Results: 9 studies comprising 321 patients were included. Discussion: capsule endoscopy enables comprehensive assessment of mucosal activity across the gastrointestinal tract and supports proactive, individualized treatment optimization within treat-to-target strategies. Riley Knox is covering gastrointestinal endoscopy. The topic is perioral endoscopic myotomy as retreatment for esophageal motility disorders, a propensity-matched analysis from a Western cohort. Background and AIMS, the long-term outcomes of POEM in patients with prior treatment failure remain uncertain. Methods: consecutive patients who underwent POEM for esophageal motility disorders between March 2012 and March 2024 were retrospectively evaluated. Results: among 564 POEM patients included, 108 had undergone prior treatments. Discussion: overall, POEM is feasible, safe, and effective for patients with PTF. Etha Vale is covering gastrointestinal endoscopy. The topic is comparison of left lateral and supine positioning for EUS-guided portal pressure gradient measurements. Background and AIMS, EUS-guided portal pressure gradient is typically performed in the supine position, whereas the left lateral position is standard for routine EUS. Methods: in this prospective single-center study, patients with portal hypertension underwent EUS BPG under moderate sedation. Results of 35 screened patients, 31 consented and 29 completed measurements in both positions. In 2 patients, supine measurements could not be completed because coughing during repositioning dislodged the needle. Discussion: PPG measurements were consistent between left lateral and supine positions. That is it for this segment. If there are any medical conferences or events you want covered, tag our team on X.
This is Conference Hype. Stay with us, coverage continues.
ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. Vesper Quill is covering gastrointestinal endoscopy. The topic is venous thromboembolism following endoscopic sleeve gastroplasty. Background and AIMS, anticoagulation is frequently prescribed for prophylaxis of venous thromboembolic events, such as deep vein thrombosis or pulmonary embolism following bariatric surgery. Methods: patients who underwent ESG from 2020 to 2023 from the Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program database were analyzed. Results: a total of 2371 ESG patients were included in this study. Discussion: the incidence of VTE following ESG is extremely low in this large prospective multicenter database. Tumor Crusher is covering gastrointestinal endoscopy. The topic is EUS versus transjugular approaches for portal pressure measurement and liver biopsy, a cost-effectiveness analysis. Background and AIMS. While a transjugular approach is the gold standard for hepatic venous pressure gradient measurement, endoscopic ultrasound-guided portal pressure gradient measurement has emerged as a viable alternative. Methods: a decision tree model compared EUS PPGLB and TJ HVPGLB over a 1-year time horizon from the US results. EUS PPGLB dominated, i.e. discussion. In patients requiring PPG and LB, EUS demonstrated reduced costs and higher effectiveness compared to TJ. Novaquin is covering gastrointestinal endoscopy. The topic is the impact of confocal endomicroscopy combined with standard diagnostics in evaluating large pancreatic cystic lesions, an international interobserver study. Background and AIMS. Current diagnostic approaches for pancreatic cystic lesions often result in unnecessary surgeries for benign cysts. Methods: subjects were enrolled from prospective studies assessing EUSNCLE for diagnosing PCLs. Results: 66 patients were included. Discussion: when combined with standard diagnostic evaluation, including cyst fluid glucose analysis, EUSNCLE significantly enhances accuracy for classifying and identifying pancreatic cystic lesion subtypes. Kai Lennox is covering gastrointestinal endoscopy. The topic is local recurrence after colorectal endoscopic submucosal dissection, a large international Western multicenter study. Background and AIMS. Western data to help guide surveillance recommendations following colorectal endoscopic submucosal dissection remains scarce. Methods: retrospective analysis of colorectal ESD at 13 centers between January 2015 to September 2025. Results: 2182 patients underwent colorectal ESD. Discussion: in this multicenter non-Asian study, local recurrence after colorectal ESD was 1.5% and 0.8% for very low-risk lesions. That is it for this segment. If there are any medical conferences or events you want covered, tag our team on X.
This is Conference Hype. Stay with us, coverage continues.
Diego Vale is covering gastrointestinal endoscopy. The topic is single-blinded randomized controlled trial comparing the effect of underwater versus carbon dioxide insufflation during PERORAL endoscopic MYOTOMY-ON post-procedural pain. Background and AIMS. Underwater endoscopic techniques have gained traction given its potential advantages. Methods: consecutive patients with achalasia subtype IN2 were randomized in a 1:1 ratio to UPOEM or CO2 poem during the study period between February 2025 to November 2025. Results: 36 patients were randomized to UPOEM and CO2 poem. Discussion: UPOEM was safe, effective, and associated with lower post-procedure pain scores when compared to CO2 poem.
This is Conference Hype. Stay with us, coverage continues.
ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. That wraps up this segment of ConferenceHype's coverage. We'll be back with more source-attributed updates soon. Stay with us.